Hi guys, welcome back to my channel. Today we will learn about the different diagnostic antibodies in SLE and prognostic antibodies in SLE. First of all, we will discuss about the diagnostic antibodies in SLE. So let's start it. So first is ANA. ANA is you can take down the notes with me. ANA is the most sensitive antibody in SLE and also best screening antibody. Because if ANA is negative, then SLE is ruled out. Okay, so first is ANA. Next is anti-Smith antibody. Anti-Smith antibody, remember, it is the most specific antibody. It is not sensitive, it is most specific. Remember, ANA is most sensitive and anti-Smith is most specific antibody. Then there is anti-DSDN antibody. Remember one line for this, it can be asked as MCQ, that it is single most preferred antibody in SLE. This can be asked as one liner or something in neetpg. Okay, anti-DSDNA, it is the most sensitive plus most specific also. Okay, and another point, titers of anti-DSDNA are directly proportional to the involvement of CNS and renal system. Hence, the titers of DSDNA will predict CPR reading of SLE. They will predict the involvement of CNS and renal. Hence, if the titers of anti-DSDNA are higher, then there is higher involvement of CNS and renal system in SLE. Hence this is also prognostic antibody. Hence also a prognostic antibody. Next antibody is APLA. APLA is anti-phospholipid antibody. I hope you know this. It is also specific and sensitive both. 50 to 60% each. 50 to 60% each. But remember, most sensitive is ANA, most specific is anti-Smith. Both most specific and sensitive is anti-DSDNA, and applies specific as well as sensitive, but it is not that much sensitive and specific. Okay, then it is associated with increased risk of, I hope you know this, increased risk of thrombosis and recurrent pregnancy losses. Okay, hence it is also prognostic. Okay. Next is anti-erythrocyte antibody. Now, it is also known as DCT, that is direct Coombs test. It is sensitive and specific. 30% each. it is now not included in the new guidelines of diagnostic antibody, hence it has become a prognostic antibody. Now last is serum C3 complement level. Persistently low levels of serum C3 indicates SLE, and also used for diagnosis of SLE. If serum C3 is persistently low, then we can consider SLE. Okay, now we will learn about the prognostic antibodies list in SLE. Prognostic antibodies in SLE. These were the diagnostic antibodies. Let's revise again. ANA, anti-Smith, anti-dsDNA, APLA, anti-erythrocyte antibody, serum T3 levels. ANA is most sensitive, anti-Smith is most specific, dsDNA is most sensitive and specific both. Its titers are will indicate severity, will indicate the direct involvement of CNS and renal system. Then there is APLA. It is associated with increase of thrombosis and recurrent pregnancy loss. It is also used as prognostic antibodies. Then there is anti-erythrocyte antibody and serum T3 levels. Low levels of serum T3 indicates SLE. Okay, now let's come to prognostic antibodies in SLE. Now we will learn about the prognostic antibodies in SLE. Remember, they are only checked when diagnosis of SLE is confirmed. When diagnosis of SLE is confirmed. Okay, now let us go through the list. There are 4 prognostic antibodies in SLE. First is anti-rolla. It can cross placenta. Hence, if there are higher levels of anti-rolla antibody, then it will cross the placenta, and the amount of this antibody will increase in fetus, and it can cause increased risk of congenital SLE in fetus. Okay, hence it can cross placenta, hence higher levels can lead to congenital SLE. The effect of SLE in fetus is heart block. It can cause heart block in fetus. But on the other side, if there are higher levels, means if this antibody is positive, then there will be decreased risk of maternal nephritis, and hence it is protective antibody for kidney. There is decreased risk of maternal nephritis, hence it is protective antibody for kidney. Next is anti-ribosomal P antibody. It is associated with neuropsychosis feature. Hence, if this antibody is positive, then it can cause neuropsychosis. If antineuronal antibody is positive, then it can cause neuropathy. Okay, and anti-platelet antibody is associated with increased risk of thrombocytopenia. Okay, so these were the 4 prognostic antibodies in SLE.